Today, I'm here to talk about an elephant, a proverbial elephant in the maternity ward. Imagine, at moments after being born, you go through the most extraneous experience of your life. Instead of bonding with your parents, you're whisked away by men and women in white coats and taken to a room where no one can hear you scream. You are then attached to a table called a circumstraint. You are then forcibly aroused, and then the functioning part of your reproductive organ is removed. This tradition is called routine infant circumcision. Today, I'm going to challenge the ethics of this procedure by educating you on male anatomy and investigating the medical reasoning behind this procedure. It is essential to understand the difference between an intact penis and a circumcised penis in order to make an informed decision. Here we have a flaccid intact penis. The outer foreskin layer, inner foreskin layer, and the foreskin opening. Note that the foreskin opening is going to be significantly larger for an adult because the foreskin is no longer adhered to the glands. We have the Frenar band. Not shown here is the sulcer, and then we have the frenule. According to ColoradoNoCirc.org, many intact men find this a highly erogenous part of the penis. It is often partially or totally removed by circumcision. For those of you who don't have a penis, this would be where the clitoris and the vaginal hood meet. Here we have a circumcised flaccid penis. This is the shaft. Where the foreskin would have been removed is a circumcision scar. We have the sulcus, the corona glands, and urinary meatus, which are no longer protected by the foreskin. Here is where what is left of the frenule would be, if any. Okay, now that we have a basic understanding of male anatomy, we can talk about the function of the foreskin and how it affects men and their partners. Okay? According to circumcision.org, the protective functions of the foreskin are that it prevents keratinization, which is similar to calluses on your hands. It protects the glands from injury, maintains sensitivity, houses beneficial bacteria that fights off urinary tract infections, and it also protects the glands from sunburn and frostbite. During infancy, it protects from feces and ammonia, and it also protects from inflammation. Dr. John R. Taylor, co-author of 2 medical anatomical papers about the foreskin, explains how being intact affects sexual intercourse. It involves self-lubrication, coats the glands with protective substance, it aids in penetration, it also reduces friction during sexual intercourse, and it also stimulates the female G-spot. Without the foreskin, these benefits of protection and sexual intercourse are lost. Without the foreskin, the glands are also exposed to the elements, which causes calluses, decreased sensitivity, no natural lubrication, more friction, and much more. With this basic understanding of intact and circumcised male anatomy, we can go on to investigate the medical benefits of routine male circumcision. The 3 most popular arguments are cleanliness, cancer risk, and sexually transmitted diseases, and infections. First, we are going to discuss cleanliness. As we discussed before, infants' foreskin is adhered to the head of the penis at birth. This protects from infections and such. Due to a poorly informed doctor, some pediatricians recommend forcibly retracting this penis in order to clean around it. This would be the same thing as lifting up your fingernail and cleaning underneath it. Obviously, with an open wound, there's an increased chance for an infection, so that's a big no-no. So it's simple. When intact, do not retract. When proper cleaning is done, studies have shown that it's highly unlikely for an infection to occur. So this leads me to believe that cleanliness is obviously a myth. Another argument is that the risk of cancer significantly decreases with circumcision. According to the American Cancer Society, this is not true. The American Cancer Society does not consider routine circumcision to be a valid or effective measure in preventing such cancers. Research suggests that the pattern in the circumcision status of partners of women with cervical cancer is methodologically flawed, outdated, and has not been taken seriously in the medical community for decades. Another thing to consider is the chance of getting penile cancer is less than 1 in 100,000 as of 2014. The risk of dying during circumcision is 1 in 11,000. This means you are more likely to die from circumcision than to actually get cancer. Let us move on to the argument that cutting prevents sexually transmitted diseases and infections. Assuming that this is true, an infant is obviously not going to be sexually active for a long time, hopefully. Regardless if you are circumcised or not, you are still required to wear a condom in order to prevent these diseases and infections from occurring. So this leads me to believe that this is not a valid reason for an infant to have circumcision. My research clearly shows that routine male circumcision in infants is not ethical, it is not beneficial in the aspects of anatomy, and it is not beneficial in the aspects of science and medical prevention. It is your job as a parent, or future parent, to make an educated decision. Make the informed choice and do not let this be an elephant in the maternity ward any longer.
Good Lord, that was right at 5 minutes. Good
5
job.
minutes.
Exactly.